Heart disease is the #1 killer in men and women in America. You can take all people with cancer who die from cancer, accumulate all of that data, and heart disease is still the #1 killer. Every year, approximately 735,000 people have heart attacks. And unfortunately, people may not be so aware of some of the signs and symptoms of what they're really feeling when they do have a heart attack. And it does lead to some delay in care and some after effects, which we're going to talk about. So classically, people get chest pain, right? That's what everyone thinks about when you think of a heart attack, chest pain. But a lot of times it can be pressure, dullness sensation. The pain can go towards the back. Sometimes people have left arm pain. Sometimes it's even in the right arm. Sometimes people describe a sensation of pain going up to their jaw. And, you know, for men and women, the #1 symptom is chest pain. But more commonly in women, they may get shortness of breath, dizziness, heartburn. I've even had a lot of women describe to me that they feel like their bra is just feeling really tight. So those are some other signs and symptoms that you'll want to be aware of and not blow off in the future. So why is a heart attack so bad? Why is it so deadly? So the reason is so here you have the heart, it's a muscle. You have these arteries, these blood vessels that supply blood flow to the heart muscle. And when you're having a heart attack, you get plaque development inside these arteries. And that plaque ruptures like a clot. And it blocks the blood flow in that blood vessel. Just like a pipe or a river. If you block the river, you're going to block all that flow going downstream. And you're going to block the oxygen going to that heart muscle. And the heart muscle could get very damaged. So the longer that artery is blocked, the more damage that could be done to the heart muscle. So when someone's having a heart attack, I mentioned that there's a major blockage going on. So this picture to the left, you see that there's just a trickle of blood flow at the top and then it stops. That's where that plaque was ruptured and that's where that clot was formed, and there's a blockage right there. So what we do is we emergently try to open that up with a little wire. We put the wire down that artery and we put a little balloon to help open up that plaque. And then to the picture on the right-hand side, the artery is now open. It's nice and open, the blood is flowing, and that person did get a stent in the artery to help keep it open. So that's what we do in an emergent acute heart attack situation.